Hi, I'm Dr. Samanjoy Mukherjee, Head of the Department of Cardiology, Manipal Hospitals Dwarka. Today I'm going to take you through the journey of management of heart failure. What do we mean by heart failure? Heart failure means the inability of the heart to pump the blood adequately to meet the demands of the body. So, heart failure can occur in various conditions. As we see the structure of the heart, this is the normal structure of the heart, and you can see the two chambers, the two ventricles, the atria, and there are guarded valves at every chamber, and the flow of the heart, the blood from the heart goes into the lungs, and it gets purified in the lungs, comes back to the heart, and then it is pumped out to the various organs. Now, how can heart actually meet up with the demand? So, the heart has to contract vigorously. It has to increase its rate of contraction depending upon the demands of the body. For instance, when we are sitting or we are sleeping, we are lying down, the demand is minimum. But when we start walking or running, the demand increases. And the heart has to compensate adequately by increasing its heart rate and its contraction. Any defect in any of these structures can lead to heart failure. So, as you see in this diagram, the heart is dilated and you see the walls, these are thinned out as compared to this. So these are conditions where we call as a dilated cardiomyopathy, or the muscle which is lost either due to blockages in the artery or due to intrinsic disease of the muscle, where the muscles actually degenerate and they cannot pump the blood that is coming to the heart from the various parts of the body. This leads to a condition called congestive heart failure. And how does heart failure manifest? So the first symptom is breathlessness, associated with maybe swelling in the peripheral parts of the body like the feet, the ankle, and gradually it can actually rise and your whole face and whole body can become puffy because of the accumulation of the fluid. Remember, heart failure can also occur in a normally structured heart, but there may be either valves leaking or the heart may become stiff as it becomes with age. And this is a very important phenomenon which we call as a restrictive heart, because heart has two functions. It has to contract, it has to relax, and both are active processes. There is a wrong concept that the relaxation of the heart is a passive process. That is also an active. So the heart has to relax adequately to accommodate the blood that is coming in, and it has to pump, it has to contract to pump the blood out. Any problem in either of the processes will lead to heart failure. So if the heart becomes stiff, it is going to lead to heart failure. At the same time, if the heart becomes weak, then also it can also lead to heart failure.